Hello guys, my name is Anita Wanga. I'm an exercise physiologist, internist, and geriatrician. I'm going to be talking about heart disease. February is Heart Awareness Month in Canada and American Heart Month in the US. So I think this topic is appropriate for this month. So before I get into heart disease, primarily coronary artery disease, I'm going to talk a little bit about what your heart looks like and how it functions. So your heart is an organ that sits in the inside of your chest, in the middle, but slightly to the left. The heart actually has 4 chambers, and each chamber is connected to different blood vessels. So the first chamber is the one that receives blood from the rest of your body, and thereafter it carries blood to another chamber, and then it goes to the lungs. Thereafter, the other side of the heart receives blood from the lungs, and then this goes to another chamber, and then thereafter the blood is pumped into the rest of your body. So the reason I'm going over this is because you can have different kinds of heart disease affecting different parts of the heart. When we hear somebody talk about a heart attack, this is what we refer to as coronary artery disease, or disease that is affecting the blood vessels surrounding the heart. You can also have what is called congenital heart disease, or heart disease that occurs when somebody is born, primarily because the different chambers or different parts of their heart are not formed in the normal way. People over time can also develop what we call cardiomyopathy, or disease affecting the muscle or the structure of the heart. Other individuals can also develop what we call valvulopathy, or disease of the different valves. We have valves sitting in between each chamber of the heart. If these have problems, you can have heart disease related to the valves. The last common problem, or last type of heart disease that we might consider, is what are called arrhythmias, or abnormal electrical activity in the heart. The heart should beat in a concerted or a synchronized fashion. If there are skipped beats, or certain chambers or parts of the heart are beating not at the same time that they should with the other chambers, then sometimes this presents as an arrhythmia, and there are certain things that need to be done to fix this. In the next video, I'm going to talk a little bit more about heart disease, primarily coronary artery disease. I will also be talking in subsequent videos about some of the things you can do to reduce your risk of developing coronary artery disease and some of the symptoms of coronary artery disease. If you'd like to learn more about this, stay tuned in. Bye-bye for now.